you. Pretty hard acts to follow. I'm very honoured to be here today in my hometown. I grew up here. I spent half my life in Melbourne. So talking up some of the early history of community action and harm reduction movement in Australia. And as I do so, I'd like to dedicate my talk today to my friend, once was partner and compatriot in harm reduction, crime and community action. I speak of the late Terence Allen Winchester. Some of you in this room knew him. I'd first also like to acknowledge the traditional owners of the land upon we're meeting today, and pay my respects to elders past, present and emerging. This always was, always will be Aboriginal land. I think I have another slide coming, and I won't be needing this because I actually only have one slide, but it really does say it all. It sums up what we've all been speaking about, and it really sums up pretty much what I'm going to be speaking about in my 15 minutes. Evidence saves lives, you know. And we do know that ideology kills. I'd also like to acknowledge and remember the many people who tragically died from HIV, from drug overdoses and hepatitis C. People who paved the way for our early responses and gave voice to our personal, political and social needs in respect to sex work, drug use, homosexuality and later HIV. Were it not for these early activists and allies, we would have seen no shift in moral and political opposition to the tide-old laws and attitudes that perpetuate these draconian responses, leaving us in harm's way. So I have to go back a little bit in time and reflect on the 1970s, and it was a time of sexual and social revolution before HIV. But this was a time when our livelihoods, our recreational pursuits and our sexualities were deemed illegal activities. When stigma prevailed in a range of social and structural settings, where police were rightly to be feared. But it was a time when we, marginalised people, started to test our mettle in the ways of power relations and resistance. And so when HIV arrived, we didn't just fall off the activist conveyor belt, you know. And luckily for us and the world, some of us were already sharpening our political claws. While my activism has been pretty much geared to advancing the social and legal position of sex workers and people who use drugs, I am forever grateful for the support, friendships, political smarts of many, many people. And as my friend Dennis Altman, AIDS activist and author, notes in his recent book, Unrequited Love, Diary of an Accidental Activist, it's actually his on-again, off-again love affair with America. It's another story. Dennis says, AIDS engendered new passions, alliances, skills that brought together the most remarkable group of people I've ever had the privilege of knowing. And I would agree with that, and some of you are in this room today. Thank you. While my focus on consumption of the stigmatised and illegal kind amongst people equally stigmatised, of which I have some personal knowledge, and I won't go into all those bits of experience and knowledge, but suffice to say, I am a sex worker and I have been a drug user. It's all led me to the realisation, the truth, that we are all consumers of one kind of pleasure or another. I think we're all talking about that too. And the sooner we accept this fact, the safer we'll all be and a more respectful world we're going to be living in. Growing up in Melbourne, this place in the 1950s was a very different place. It was a very conservative town. And I'd been raised to believe that the police were there to support people, to protect people. They were good guys, you know. But suddenly, as a young law clerk, working in a criminal law practice just down the road there in St Kilda, this belief was shaken. I was hearing of police practices that could curl your hair. All of which became, I was really old enough in this room to remember, but Alex. All of this became the subject of the 1975 Beach Inquiry into corruption in the Victorian Police Force. I move on to Sydney. 20 years later, the New South Wales Police were similarly scrutinised by the Woods Inquiry into police corruption in that state. That led to the decriminalisation of sex work in my state, in New South Wales. So these early experiences was a light bulb moment, one that would dictate my future and take me down some very interesting pathways. What we didn't see, and I didn't see at the time, and just around the corner, it would change all of our lives forever, was HIV. HIV was the catalyst that brought us together and it helped forge the necessary alliances with politicians, healthcare professionals, bureaucrats, social researchers, and even the media. Regardless of our sexual identity, employment in the sex industry, or drug use, we saw benefits in sharing our collective experience, knowledge, and skills. Underlying this was a shared sense of personal and social catastrophe once HIV had hit. Underpinning the broader Australian response in respect to the prevention of HIV was our early adoption of the Ottawa Charter. That prevention requires involvement and empowerment of affected communities, stuff that we were already doing through our voluntary groups, which we were able to formalise later with funding. This allowed some very early, innovative, effective responses to begin, and as our national HIV strategy and international bodies such as UNAIDS, the WHO, et al. Continue to acknowledge today, communities affected by HIV, and I'd add now other blood-borne viruses, were best placed to address the issues by leading their own organisations, developing and delivering their own style of health promotion and related advocacy. This partnership gave us a platform for pursuing our broader social justice agenda and to really then test our mettle in the ways of power relations towards sustained social and legal change. But it didn't always make for happy bedfellows. But it was a time when we went about our work without the evidence that science and research can provide today. But we knew from our own experiences, however, what was wrong and what needed to change. Harm reduction and consumer advocacy was at the forefront of what we were doing, but these descriptive terms hadn't yet been invented. They were not part of our lexicon, and sadly they weren't part of the practice of most human services. And the person, us, had yet to emerge. It was a time when you couldn't use the word advocacy in your organisation's name, when you could barely rent a property or get insurance for your organisation, public liability, someone falling over the step when they arrived to pick up syringes. Because the words in those organisations, like prostitute or drugs, were deemed illegal. We were constructed by society as an alien or an other, not a person. Even the word advocacy needed an advocate. I do recall that if you wanted to get funding and keep your funding, you needed to ditch the word advocacy if it appeared in the title of your organisation. And you couldn't have a current or former person who used drugs as a treasurer on the board of your drug user organisation. It was a time when sex work, or the then more pejorative term prostitution, was deemed self-destructive behaviour, a form of self-harm, and generally a metaphor for all kinds of ills, mental and moral, and an out-of-control police force feasting off criminalisation. And the treatment of people who used drugs didn't fare any better. Some believed community development initiatives amongst sex workers and people who used drugs was impossible. They were not a community. They had nothing in common. You couldn't unite them like if you unite gay men. Well, how wrong they were, and what a formidable response we've mounted. If you happen to belong to both camps, you're in for a very, very rough ride through the system. Thus, we needed to shake up the caring profession to be truly caring and respectful of lifestyle and occupational choices and having a say in treatment. Before advocates emerged as part of the HIV community response, clients or patients were largely to be seen and not heard, like little children, or at best admonished for their choices. So while HIV gave us opportunities and funding not experienced or even imagined, it gave rise to all manner of human rights abuses and moral panic, including the idea by some that people with HIV should be quarantined on an island off the east coast of Australia, or, at best, placed in a locked ward. Stigma and discrimination, 30-something plus years on in this epidemic, is still a daily battle for most people living with HIV. Into this milieu entered Charlene Spiteri, a young woman living with HIV, who was an occasional sex worker and person who occasionally used drugs. Her life circumstances were such that she was rife for exploitation and was coerced to appear on a 60 Minutes program. During the interview, she affirmed that while she tried to get her clients to use condoms, sometimes they refused, or take them off while she wasn't looking. This interview went viral, and in an attempt to silence her, the New South Wales government placed her under guard, first in a locked hospital ward and later under house arrest. Charlene spent the next 16 years in varying degrees of custody, convicted of no crime and no sentence, remained sedated on prescribed medication for the rest of her life. She became the most expensive public patient in the history of New South Wales Health, apparently. Charlene died in 2005 while still under house arrest. This is definitely not one of our finest moments. On to sex work now. Sex worker organising in Australia commenced in the mid-70s, where feminists of the day stood in solidarity with us, primarily as a labour rights issue. A far cry from today's anti-sex work feminists and their faith-based mates, pushing the misogynistic Swedish model that criminalises third parties, including our clients, making life more difficult and dangerous for us. With the advent of HIV, the Australian Prostitutes Collective New South Wales, of which I was the inaugural in-house manager, that morphed into an organisation called SWAP New South Wales, that exists today, was the first organisation of its kind anywhere in the world to attract government funding, which has been central to the prevention of HIV transmission and a human rights-based approach to sex work and sex work law. Decriminalisation was achieved in New South Wales, as I said earlier, in 1995, and in New Zealand in 2001. And there's a current groundswell of activism around the world to bring about decriminalisation on a global level, and I hope I see a bit more of that in my lifetime. Activism amongst people who use drugs would take a little longer before similar, perhaps even braver, articulate voices and leaders emerged to take that community out of the shadows and raise its collective voice for change. ADIC, AIDS Drug Information Collective, the name was given to us by a policeman who was a member of our little group. But it was the first group that emerged in New South Wales in the early 80s, taking a pragmatic approach to reducing harm. So this disparate group of healthcare professionals, researchers, sex workers, police, people who use drugs, had one thing in common: the belief that people who injected drugs deserved to be treated with dignity and had the right to accurate information, clean equipment and non-judgmental support that would help them protect themselves. Morphing into Newer, another little organisation I had some involvement with in the beginning of time, New South Wales Youth and AIDS Association, that exists today as a funded peer-based representative body for people who use drugs illicitly. It is the longest running, continuously funded group of its kind in the world. So while each state and territory has a funded response to the prevention of HIV in terms of sex work and people who use drugs, contrary to the national strategy, the Ottawa Charter and all of those international aid organisations I mentioned before, not all are peer-based. Some are only just emerging as independent bodies, and others doing the heavy lifting remain unfunded. And you'll be listening and hearing from some of these people later on during this conference. So 30 years on, we have truckloads of evidence. We know better than to deny programs and legislation that protects people, prevents human rights abuses, and prevents death, suffering, and spread of disease. However, ideology is creeping back into frame, ignoring the evidence, including the more than 14,000 unintended deaths due to overdose over the past 10 years, clearly tells us, me, the old but new again, just say no, and let's ban an approach to drugs is a deadly failure. Like those that deny the evidence that climate change is real, we exist in an age where conservative forces are wresting control of the steering wheel back from us and making a sharp U-turn back to the 1950s where I came in. So it's now up to you, all of you, new people, young people coming into the harm reduction world, the community world, to ensure our gains continue. People first and taking no prisoners, as you assert what you know is right, as we once did, to ensure no one's left behind. I speak particularly here of Indigenous peoples and people who use drugs and those who live with mental ill health, of advocating for sensible public policy in respect to drug use and the associated harms of the continuing war on drugs and the unfinished business in sex work law reform, and supporting the funding of peer-led representative bodies. Our work is not done. Our personal remains political. And as they say, many a rally, and as we proved in the face of this existential threat, the people united shall never be defeated. Thank you.